Dr. Stewart, Timonian Foot and Ankle Center. I have patient Helen here. Hi, Helen. Good morning.
Hi, good morning.
Hi. So Helen came to us several months ago with a lot of pain in her foot. If we come over here, she had a lot of pain right here in her fifth MPJ. And as you look at this now, there's barely any callus here. But she had a ton of callus here, and she was basically walking on her bone. So she came in, and she was having a lot of pain in her foot. And she had basically an extremely painful callus. What were you feeling when you walked before we did anything to treat this?
It was like I had a stone in my shoe, and it kept me from taking a daily walk. It kept me from walking.
Kept you from walking, which is what you like to do for activity. Okay, so she came to me, and she was coming in on a regular basis. Probably every 4 or 5 weeks, we were cutting this callus down, and it trips back and forth to the doctor's office. And I mentioned to her that we can consider a bunch of treatments, one which was an orthotic, but more importantly, the orthotic paired with a dermal filler. Essentially, if this is her skin, this was her bone, she was skin on bone, and every time she walked, her bone was driving into the ground. So what we did was we injected a dermal filler called radiase, which actually fills the void, so it's not that her bone is sticking on the ground. The only way to eliminate this from happening would be to surgery, to operate on your foot, which obviously has risks, has time off, you wouldn't be able to drive at your right foot. So we put the dermal filler back over here, and we can see this is nice and plump, and there's barely any callus there anymore. We have an orthotic, and we made special offloading pads. So we offloaded this area, we redirected the weight back to her foot, and it takes all the pressure off of her foot there. Tell us the result.
I'm able to walk as often as far as I want to without pain.
And she actually said to me today, she's like, I really don't think about my foot. As a matter of fact, she's coming here more so because her toenail bothers her. But before, this was like a very common topic of conversation. It's been several months now, and you're doing whatever you want. Are you happy we did this?
I'm happy.
Are you happy with the orthotic?
Oh yes, I'm going to keep my orthotics, my shoes.
And she's wearing the right shoes too. That's important also. I typically recommend the Brooks Glycerin GTS. A lot of the Brooks shoes are great. I just happen to like the Brooks Glycerin GTS because it's a very supportive shoe, has a lot of cushioning on the bottom, and it also accommodates the orthotics very well. This is a great example of a patient who had a lot of pain. We did a simple dermal filler in the office. We paired it with an orthotic. I don't see her that much anymore, which I like seeing you, but more importantly, I'm happy that you don't have to come in for treatment of your foot. So thank you for sharing your story.
You're welcome.
If you'd like to learn about more information about orthotics, dermal fillers, shoes, anything else, call us, 410-560-2777. Thank you.